Welcome to episode 8 of the Runs Club podcast. If you're living with an ostomy, you're preparing for stoma surgery, or you simply want to better understand what life is like with a stoma, today's episode is for you. I'm joined by stoma nurse specialist Aisling Dunne for a very honest conversation that's packed with practical advice and lots of answers to some of the most common questions that patients ask. So whether you're newly diagnosed or you're years into your journey, I think you really take something valuable from this. This is my conversation with Aisling Dunne. Aisling, welcome to the podcast. How are things?
Good. Good to see you. Take two.
Good, yeah, take two. This is our second time recording this podcast because unfortunately we had a technical issue the last time, but this time hopefully no technical issues and we'll get through it. So I suppose to kick things off, how did you become a stoma nurse?
Well, I was working in the UK, did an awful lot of colorectal work, moved back to Ireland, kind of what am I going to do next? Worked in theatre, once again ended up in a lot of colorectal surgeries. Job came up, seen a stoma in about 13 years apart from the ones being made. And I said, you know what? I'll give it a try. It's a new challenge. I like surgery, like being with people, because I used to work with anaesthetics at the time and I was kind of getting bored of everyone asleep on me. And yeah, just the patient side of things. I was like going, do you know what? Surgeons were lovely here. They were all like supportive when I was suggesting about doing it. They were like, yeah, give it a shot. 12 years later, still here.
It's become the vocation now, and I imagine it's not something that I imagine a lot of nurses will dive straight into. I suppose when you get to training, you're not going, oh, I'm going to be a stoma nurse. When you first started off with it, were you a bit nervous about heading down the stoma route, or were you like, no, this is something I really want to dive into?
Well, I had a great trainer, Mary, who taught me everything I know. So, and she was in it 30 something years when she retired. So she was just so good, so knowledgeable. So I just fed off her. And I did have the surgical experience. And there was a lot of learning. There still is a lot of learning. There's still new things that I'd hear about that I'd be still looking up. And, you know, I say every day is a learning day, you know. Yeah, it was hard. It was tough. What was so hard, I suppose, was getting used to the products and stuff. Now, there's way more now than what there was 12 years ago when I first started. But it was daunting between one pieces and two pieces and this seal and that seal and a convex ring. And I was like overwhelmed, and you had booklets of all these codes and you're like, how am I meant to decide what's best or what's right? But that comes experience, and it still is. And there's some things I could be, nothing's really a go-to sort of thing because everything is so good now. But it's just trial and error with everything, and there is still trial and error with everything.
Yeah, 100%. And shout out to Mary, because Mary was the lady who guided me through my first stoma. So a lot of this episode now will be a homage to Mary. Mary, for listening, how are you?
Mary Liz, it does. I got
Yeah.
She's probably on a beach somewhere going, oh yeah, I miss them days. No.
Yeah, partying in Ibiza thinking about stomas. I don't think so.
Yeah, exactly. But I know she was amazing. My God, I did not want her to go. She could have stayed on. And I'm very lucky because we got Neve. So it was just like Mary just had a wealth of experience.
Yeah,
You
a
know,
great
she
woman
knew
to learn from and to work under to figure things out and gain her knowledge. Because as you said, she's over 30 years experience. Like what a lady. When
Sure.
it comes to how products and everything have changed so much over the years, I spoke to a man a couple of months ago who contacted me because he was in quite a stage of depression, thinking about he'd have to get an ostomy again. And when I showed him the equipment that I was using, he was like, oh my God, this is completely different to what I went through in the 90s.
Yeah.
He actually spoke to me about how his relationship with his wife broke down because she wasn't able to cope with it. And then he was fearful that image and his previous experience would be something that would happen to him in the future. But when he saw how much they've progressed and how much neater and everything like they are, it really changed his mind on it. He subsequently got the surgery and that was great. But I suppose you have the knowledge of seeing how things have changed so much. Has there been indiscreetness and different things like that? Has there definitely been a massive change in quality of product?
Oh, definitely in quality. Even colour is a huge thing now. It's all about like the blacks and the whites and the fresh colours. It is just huge. And yeah, we have the nervous patients that come that their parents might have had a stoma 15 years ago, 16 years ago, and they'd have the clips and stuff, which when I essentially came along, we were using post-op clip bags. You know, and so much harder to deal with, and no filters and some with filters, and it's amazing the way, but it had to come along because we have so many patients in this hospital. We do 200 a year, and like in Ireland our numbers are just going up and up and up, and the UK they're going up, so we need to have the products there. Our patients are getting unfortunately younger and younger and younger, and they want choice, and they should have choice. You know, as I say, it's not one bag that fits all. It's like you can try new things. Yeah, if it's not broken, don't fix it. Fair enough. Some people could be on the same bag that they went on 8 years ago and haven't changed. That's because they like it and it works for them. But they know if they need to change, they have the flexibility and the support to do that if it works.
Yeah. 100%. Like I was using the same product for about 13 years, and it's only in the last couple of days I've changed for the
Yeah.
first time. I was quite nervous changing, to be honest, because you get so used to something. But great. Yeah, there's definitely been massive innovations, and it's definitely a lot sleeker to my body compared to the older, kind of bulkier version I was using. But as creature of habit and knowing that it's your safety, I was always very afraid to change. And you'll know yourself that I'm a complex case when it comes to skin. So
Yeah, but it is, and it's like people going off from one pieces to two pieces, are changing from a click two piece to a stick on. It can, yeah, and there is an awful lot of change, but there's such a variety. And look at, as I say, if it doesn't work, we just go back to the drawing board again, which is
yeah.
the beauty of things we have.
Diving into life as a stoma nurse, what does a typical day look like for you?
In the morning we come in, we have a new referral thing. So all the doctors or the nurses on the wards, they'd put up a Stoma Care referral. So we'd look at that first thing to see if we have anyone for surgery that we need to go over on site. Have a look at the book and see if we have anyone in clinics, ward education, staff education, admin. No day is the same. I try and avoid the admin as much as I can and kind of be patient focused, but that's just me and computers. But yeah, no, it builds, it changes. You could have your list of inpatients and you'd be like, go A, B, C, D, but they could be gone, scans, surgery early. You might get a phone call, something's happened in the day or something, or you have to go to a ward, there's someone after coming into ESU, the emergency surgical unit, needs surgery. And so it chops and it changes. It doesn't stay the same for us. It's busy. It's like, yeah, it's not a dull day anyway. That's for
Yeah, I
sure.
can imagine you have to attack every day differently from different things that might crop up. Like
Exactly.
I imagine sometimes it gets quite manic with different incidents, and like I suppose it's kind of the Murphy's Law or whatever, that on one day you could have 5 people ringing with the same problem, another day you could have 0 people ringing. It just seems whatever way the world works.
And it can be. It's just like when the hot weather is like what we have at the minute, it is like the dehydration calls, it is the blockage calls, it is the bags don't stick calls. All part and parcel to it. At Christmas time, it's the calls with the excessive diarrhea because they've had a box of celebrations or Christmas cake, or it just varies day to day. Sometimes you can nearly know what they're about to ask in for. Sometimes.
That's what you call experience now.
Yeah, it's like, oh no, I don't.
Just we kind of touched on there earlier about how many cases you do every year, and the
Yeah.
demographic slightly changing, that there are much younger people kind of getting it done now. I know from my own experience, when I first went to an ostomy, I suppose, meetup, I was only about 14 at the time, and everyone was so much older, to the point where I was like, am I the only young person in the universe that has ever experienced this? But recently you had the Stoma Care Day, and it was absolutely brilliant to get such education and meet so many other people who were kind of in the same boat. But the thing that I noticed that was so different about it was how much younger the amount of people in the room were.
Yeah.
Really speaking testament to how things are changing. But when it comes to what people are coming in experiencing and needing stomas for, is it mainly IBD? Is it cancer related?
It's mainly cancer related. Like 80% of ours would be cancer related. IBD numbers have come down with us, but then I'd always say, like, the HC is a challenging place to get into, and beds is a huge problem. So the booked IBDs, benign cases, cancer takes preference. So they could be pushed out unless as you're coming in as an emergency. So what we would see more so of is the cancer. But it sweeps around in waves and in roundabouts. But unfortunately, definitely the majority is the cancer in our work. There's a bit of trauma. IBD is up there. It is decreasing as the biologics getting better, but then you get people that never had UC, or didn't ever flare up for 2 months, and wham bam, then it's straight to surgery. And then you've got the people that suffered all their life that finally need surgery. It varies. It just comes in. It comes in waves on what we see. And
100%, much like trial and error and finding the right bag. It's an individual case on how these symptoms and stuff progress to the person. Like I spoke to a guy a couple of weeks ago who only got diagnosed with ulcerative colitis and 6 weeks later ended up with a bag. And like, how do you even process that? It hasn't taken over you're sick for those 6 weeks, but for me, I had years of trying to process this before I actually got it. Whereas for someone to turn around like that is a very traumatic experience, to have such a quick turnaround and such a life-changing surgery. When it comes to people who come in and you have to do consultation first to tell them exactly what's going to happen when they get an ostomy bag, what are the main questions that people would first have when they're first floated the thoughts of that they might end up with a stoma?
Sometimes I find the surgeons, when they kind of get to them first and they could have a negative approach of starting off with going, look, I'm sorry I have to give you a stoma, and I nearly try and stop them from saying that, because I'm like, this is life changing. If you go in and apologise for something, like, you're not apologising going in, by the way, I'm putting a drain in your abdomen today, you have to start off being the positive, because the patient is going to focus on, well, the consultant said, sorry, he has to give me this, so then that's not right. I shouldn't be getting this. So we need to kind of move away, and we are moving away a bit from that. It's just like, it should be just more like, this is our plan, this is what we have to do, this is life-saving, whether permanent, reversible, whatever, just kind of go through the process. Most people are worried, like, what they could see, like, older lifestyle, is it going to change things? Is it going to stop them? Is it going to stop them from traveling, going places and meeting a partner? There's hundreds of different things that goes on their mind. But then it's different in the patients that we see. The cancers have just been told that they've got cancer. They're trying to process that. Then they're told they might have radiotherapy, chemotherapy. The IBDs is like, my biologics don't work. But as I always say, I always focus on quality of life. That's what I sing off. I don't sell surgery. It's quality of life to the patients. If you're an IBD and you're going to the toilet 30 times a day, that's no way of living. There's no way of trying to find a bathroom here, there and everywhere. Life with the stoma is to improve things, and it does to improve things. But telling them that when they're so sick and they don't know, and then sometimes I'd walk in, they'd be like, operating me now, no questions, mark my tummy, off you go. And they live life, and a lot of the time we have this sooner with our IBDs.
Yeah, I could definitely speak to that. Now, I would never say that I do regret not approaching the surgery healthier. Mine was emergency surgery because because I was so afraid of it. I was so afraid. Like, I literally I wanted to die rather than end up with a stoma.
Yeah.
And I built up this false reality in my head of what my life was going to be. Because unfortunately, there wasn't the level of access and ease to education. I had met people, of course, to talk about it, but it wasn't going in. I was just people in consultation-wise, surgeons, different things like that. Whatever they were telling me, I was like, it just wasn't going in. I was so averse to it. Whereas now with social media, and just like you coming on the podcast today and speaking, it's so much easier to get true lived experience and information to really get an understanding of what stoma life is like. And as you said, it's quality of life as opposed to surgery. And for me, myself, quality of life is, like, you couldn't even compare the life I lived before I had the stoma to the life I have now. Of course, IBD is a fickle beast and unfortunately can come back. And that's something that I try to let people know as well, that if you do get surgery in this IBD, it's not just this fixed, it's, game over. You still have to mind yourself and do all things afterwards. Because I myself buried my head in the sand after my first surgery. I thought, oh, it's gone now. I'm fixed. I'm fine. Don't worry about it. I can drink and smoke and party to my heart's content. No.
Yeah. Well, also the IBDs, it's very much Crohn's and ulcerative colitis, two different things. Like, you have to think Crohn's is everything from the mouth to the anus. Ulcerative colitis is large bowel, but it isn't a straight fix straight away. It can take a while, even with the UCs. Yes, we take out the large bowel, but if we leave the rectum behind, that can still have a flare up until we take out the whole lot, And plus, the taboo is there as well. It's like what they're afraid of. No one talks about how they go to the toilet. It's not a question that people ask and go, well, how are you going to the toilet today? And I think it is getting better. More and more people are talking about it, which is good. And it's just about getting the right type of information.
Yeah, absolutely. And there's definitely a much better awareness. Like, a lot of the charities are doing great work, like Crohn's Colitis Ireland. People are speaking so much more openly online. I even see a lot of more gut health promotion. Like, I was at Bloom Festival there recently, and there was a lot of things up just directly about, how often do you need to go to the bathroom? It's opening the door to conversation so that people don't feel there is that taboo on it. Because we all know it's not polite dinner conversation. It's talking about how many bowel movements we've had in the day. But we make a laugh at home in my house that, talking about shit at the dinner table is just normal.
Yeah. Yeah. Same in mine.
Yeah.
No questions.
When it comes to educating people about life with a stoma, what does good pre-op education look like to you?
Pre-op education is excellent. And I very much like to see the patients kind of pre-op if I can. But as you know, unfortunately, clinics have moved out to Merlin and staffing shortages, we can't be there. While it used to be like, if the surgeon met them that day, they'd knock on the door. They're like, would you mind just saying hello? Even if it's just a hello and walking off, it's leaving my contact details with them. They might want to talk that day, and that is fair enough. It depends on what they're told. But they've opened the door to have a number that they can ring us, or we could give them a book. And it's so much easier that they have met us. We've talked through the surgery. They know that they're meeting the morning of. They know that we're citing them for surgery. We're kind of going through any fears if they wanted to speak to someone. Just that we're there there, and I find they do so much quicker in like discharge because they've seen it. They might have tried the bag. They might have tried to wear it. They know how to manage it. They know how to work it. And then it's just learning curve. As I say to all the patients, the more practice you do, the more questions you ask, the better you will be. So it's just opening, it's very much opening that door with them. Like we have very close, obviously, relationships with our patients. So it's just open the door. They could tell you something. There's something you might know until when they come back to clinic 3-4 weeks later, you know, that they might be afraid to ask in pre-op, or they mightn't think of it because they're so overwhelmed. But they just know that they have that contact there. Like our patients are lifetime patients, you know, until I retire. But you know,
Until you pull a Mary. Yeah.
yeah, right. Look, win a lot of, yeah, no, but you know, and that's what it's there. It's like going, you know, for patients to know that they can always come back in and talk and open the door. But pre-op is huge. Like it's very hard when you see someone all of a sudden, and it happens with emergency surgery. You have 5 minutes. The trolley could be outside the door waiting for them. They need to go now. The slot is ready. It's like you nearly like feel like you're assaulting them, going, "I need to mark your tummy now, please." You know, and then it's when they come around, they're so much sicker, and it just takes a while to get their head around it, which is very, very normal. While if they're good and healthy and, you know, in the fit of their health and they can think of things, and if they have the book and as they said, they can read it or they can go online, we'd give them useful resources like stomanurse.ie, the Irish website that we have. So they can be looking at things and going to ask that. And yeah, I always say, yeah, you have our number, leave a message on the answer machine, we'll get back to you. If I don't know, I'll try and find out. I wouldn't know the answer to everything, you know, and nothing is a stupid question. And telling them that it might seem daft to them and they'd be afraid to ask us, but it's not daft at all. It could be the basics. This is a new way of life for them. So, you know, it's going to take an adjustment, and it's a huge adjustment.
And I just want to say credit to you in the availability that you have, because when I've gone through issues with, I know I contacted you about 2 years ago when I was at a blockage, and we were freaking out. I thought I'm heading for surgery. They weren't listening to me in A&E. And when I got through to you, I can't remember if I left a voice, but you called me back so early in the morning. And I was like, I'd ring him out. I was like, it's okay, Aisling knows. And it just put us at such ease to know that the support was there and someone who knows the case is there and standing up for you, essentially, and there to fight your case for you. So like the availability puts all of us at such ease. Another, and I have to, Mary, if you're listening to this, I rang Mary with a hernia when I was out in Lisbon on a stag party, and she was like walking me through on the phone, being like, okay, tell me what it looks like. Yeah. Are you drunk while you're ringing me? No. Okay. And I'm just like, is it black? No, it's fine. Where is it sticking? I pushed it back in. Shouldn't have done that. But she talked me through it, and I was like, do I have to get in a flight to go home? And she's like, no, you're fine. Enjoy the party. Mind yourself. And straight away,
plenty of them dolls, like we do. I got them recently on holidays. You know, it's just like dehydration or like that blockage. Good, I have to come home, but it's like no, just you know, and you get to manage it. You know, yeah, it is like a weekends when we're not here. But like that, I'd have patients ringing me. The hardest part is the A&E part, but then it's like when you get through the system. And our surgeons know, and you know, that depends on who's on call. And we've got such a good relationship with the docs because we know them so well. They operate all the time. You know, we'd be able to tell them what's what, and look, this is what they're going through. You know, and it's there. The emergency surgical unit here is very good as well when they get into that. It's kind of like the A&E, but for the surgery patients. You know, it's a really good place.
One thing that I just kind of like to dive into, I know we spoke there about how people can get quite overwhelmed and like with when it's first of all the idea of a stoma. For someone who's listening to this and they have a family member or partner or someone who's possibly going to go through stoma surgery and they are feeling overwhelmed, how would you best offer them advice on how to support them?
Giving them that support. If they knew who to contact, it's the information that's out there. Like online can be scary. Now it's got better because it's more open, but some people will be looking at videos from America and how to keep a bag on for 2 weeks because everything is so expensive over there. It's just all about getting the right information. And that's what I was saying, like stomanurse.ie, our website, the Crohn's and Colitis. You know, there's different options. It's getting them from the source, is getting them from the good source. If like we could be on Google and we could get a phone call or just a query, we mightn't met them. Obviously we can't say too much because we don't know anything about them, but it's just putting them on the right track. And I think good information is key. And it just helps. And for family members, yeah, it is daunting, it is worrying, but you have to work off the person too. It's like and how they're feeling. And I don't know, you can have some, yes, overbearing mothers on their kids, and you're just like going, chill. Like, you have to let your child go through this. Yes, be there for them, but it's their life, it's their journey. Be there for helping them. Don't be running off a mile a minute and asking 40 different questions that may never happen to them. You just have to let them process everything. And as long as they know that you're there for them, and that's the main thing, is they're there for them. And as we said, family members are struggling too, and sometimes we forget about the family members. Like, your poor mum saw you at such a young age going through what you did. That is so, so difficult. And the same when we have babies and kids, it's like they're never going to remember it because they're more than likely going to be reversed. It's the poor parents that are traumatized and don't know what's going on. It's just everyone kind of has to be kind to each other, but take a step back, but just be there for each other and kind of just take things as it comes. Like, unfortunately, for cancer care, there is psychological support with Cancer Care West. For IBD, there's nothing out there unless you go private, which is such a shame, but it's across the board. It's here, it's in the UK. It's just, it doesn't have, there's just no facilities kind of there for it, which is such a shame, but that's healthcare.
Yeah, completely. I interviewed a girl in, I think it was maybe the fifth episode, Ruth Gibney, and she had cancer. And she said there was such support through the charities for her and her mental health and everything. So she's never got that level of support at all from the IBD side of things, where it's like there's a real missing point there
There's,
in how much. Yeah,
yeah.
it's very tough because I know myself, I suffered massively on mental health over the years, and I was lucky and privileged that my parents were in a position to pay for me to go to see someone in counselling and stuff like that. But it got quite expensive, and if I hadn't been that lucky, I don't know where my head would be as of now, because I wasn't coping very well, and I wasn't coping very well after I got the stoma. Reaching out to these different supports, the charities are great now that are available. They try and help people as much as possible, but unfortunately, it is a bit of a hole in the system that people who suffer with things like IBD, which can take over every single day of your life, that there is
Mm,
no mental health supports there to support people.
mm.
Just when it comes to the kind of mental health side of things, do you notice a difference in how men versus women cope with possible stoma surgery, or in the time afterwards?
It depends. It kind of goes through the waves, and it depends very much between why they've had it, whether it's trauma, IBD, cancer. Men, I think, suffer a little bit more. Younger men, I think maybe more women are more resilient. Kind of, I don't know. I don't know. Is it like body image and stuff like that? They're more out there with everything. It's who they follow online and who they see. Men, I think, sometimes are a little bit shyer. But then you could have older men that will just get on with it, and older women could be a bit more nervous. It's very patient dependent. I could look at my board now and I'd be like, oh, yeah, more nervous men than women. Vice versa. Next week could be completely different. It all depends on what they've been through and the kind of what's happened before it. And the timeline before the surgeries play a huge role, whether they've been sick, whether they've had treatment, whether was it a trauma, was it ended up being a car accident, was it falling off something, it all just comes down to that and the support they've had prior to surgery. Some I'd be worried about could breeze through it and completely shock me. And then others that seemed quite confident, then when they had it, then just got very upset. I think in their head they were like, going, this is going to be fine. And then they see it and then they get frightened and scared. So it is very different. Like, you could ask me that and I'd be like, no, men more than women. But then you could ask someone in Mayo, Sligo, and they could say something different. It's very much dependent on what your groups. I think it's because we have a lot more younger here. I think in one way the younger ones nearly are coping better for it, but then you have the IBDs that, because it's talked about much more, they know more what's coming down the line, you know?
I was just looking there for a stat. I only saw it online on Instagram, and I can't fucking find it now. But that there's actually, by demographic, more men than women with stoma bags in the UK. Which, with the amount of people you see talking online about it, I would have thought that it was completely different, because there's such a small demographic of men that
Mm,
talk about it, whereas such a larger demographic of women that make content and share their experience. So yeah, I think men must be a little bit more cautious about sharing their story and things
yeah,
like that. So yeah, whereas I think
I
women are
think so.
much more open about talking. Yeah.
Yeah, but I think that's in anything, whether they've a stoma or not. Like, they always say mental health. It's men you to worry about a lot of the time because they don't open up. Sure, us women would talk about anything. There's no filters and no boundaries half the time, especially in the nurses kind of side of things. So I think, yeah, that's got a lot to do with it. They're nearly afraid to talk
Yeah.
about it more.
I completely get that, because it was my deep, dark, dirty secret for so long. Like my friends would have known I've had it, my family would have known I have it, but I'd often, until I started talking online about it, I met people I went to school with. It's like, we thought you were just Mitch in school, and we didn't think that there was anything wrong with you, because as a man, you don't want to be, as anyone, I suppose, I can't just say it specifically to men, but specifically from my own experience, I didn't want to be looked at as weaker, less than, or people saying, oh, that's the fella with the bag, or that's the fella who's in and out of the toilet the whole time. You'll make up lies. I used to make up lies that I was Mitch in school, because I didn't want people to think that I was actually sick. But in the sense of the stoma, I wouldn't take my top off at the beach or anything like that. Whereas I was always in the gym and stuff, but because I just didn't want people to know that part of my life, you become a little bit more reclusive in moments like that. But there is a great movement online in the whole body positivity side of things, of people showing off their stomas and being so much more body confident. So it's kind of paving the way for the next generation that will maybe unfortunately have to go through that. When you speak about people who have to get surgeries to a trauma, is that kind of car accidents and stuff like that?
Yeah, car accidents, falling off a roof. Depends. We've had little spinal surgeries that went a bit difficult. Kind of people are irrigating for a long time. They eventually realise, right, I think we might have to go down this route, because that's a whole nother ball.
There's a lot of different routes to stoma life, unfortunately, but
it's not the same. People just think they just have fur cancer, and I'm like, no, there's lots of different things. Like, people do forget about the paraplegics and the wheelchair users, and not going, if they're irrigating a couple of hours a day, having a stoma can be a lot easier for them, and a lot of them end up then eventually going down the route. It just depends. It depends on their rehab. It depends on their lifestyle, and it all depends on their circumstances.
Completely does. It is very individual. When it comes to educating people on diet and preventing blockages and hydration and stuff like that, what advice would you have for people who are kind of find their feet at the minute and they're figuring out diet-wise, how am I going to approach this?
It depends. Like, what we do is we give them a book post-op, and then we give them a sheet, and it has like little diet tips on it. We get the dietitian to see them, which is always really good. Like a colostomy, which is large bowel, shouldn't really have any issues, because basically all they're missing is the back door, so the large bowel is still there absorbing. It's the ileostomies that you worry about. It's them that can get dehydrated very, very quickly. It's them that we have to warn that they can never get constipated, never be giving them laxatives. It's just certain foods. Someone mightn't ever get a blockage. Then I could have someone done 10 years ago and get their first blockage. It's different. And then you have everything so right at the start, and they're so good at the start. It's like mouth like a blender, chew, and everything is perfect for the first 3 months. And then, hell, their life is back. I'm going on holidays, I'm doing this, that, and the other. It's just being mindful. That's all it is. And just thinking, going, your own body, how your gut works. Don't abuse your gut, per se. It's just certain foods, hydrations, hernia supports, giving them exercise, working their core. We want them to be up, about, moving, getting back to being fit, getting back to being healthy. With their hydration, I always say 2 things to have in your cupboard: be Imodium and Dioralyte, especially for all the ileostomy patients. That in case that there is a flare up, or it's just a bit high output, or if there's a bit of a blockage. Kind of my main piece of advice is if you start getting sick, you need to go into A&E. A lot of people can manage blockages at home, like cool boiled water, get up, walk around, don't stick to the bed, gentle massage. But if you're getting sick, it is into hospital. Unfortunately, they have to come. 9 times out of 10, nothing's done, put up and drip, few pain relief, home again. It's rare that we will have to do anything, but you're just being scanned, and you're just in case that why you're here.
Yeah, I understand. Approaching it with that level of caution. As I said, if you are getting sick, most blockages, I haven't had blockage now in over a year, touch wood.
Yeah.
But it was just from not chewing my food right. Now, but previously it was from scar tissue. There was no avoiding that. But just from I suppose inflammation that was inside and not chewing my food properly. You kind of do, from trial and error, realise what foods you can't have. Since my most recent surgery, I used to always be able to eat coleslaw. Can't anymore. So I suppose there's less intestine in there now to break it down. So that's probably the problem. But when it comes to things like smell and odour, how would you say, what foods would you recommend for people if they're feeling that their output is a little bit more pungent than they'd like it to be?
It's all down to diet. It's like I always tell the patients, it's like going, if you didn't have a stoma, like onions, fibrous food, turnips, they can all give you odour. They can all give it running. Same at Guinness. There's always a thing known as the Guinness part. It is the same rules apply. It's just about managing it and managing diet. What really good is like natural yogurt, peppermint tea, really, especially natural yogurt for cleansing your gut and the foods. It's just watching what you eat. The odour comes down to what you eat. what you put into your body. And as I said, everyone is different in what they eat. No two people are the same. What you could eat, another ileostomy might be able to eat fine and be looking at you going, what's wrong with you? I can eat them. It just, everything changes. Everyone's gut is different, you know?
Yeah, completely. I put up a post recently, kind of jokingly, the 5 foods that could kill me. And it was like mushrooms, sweet corn, popcorn, all these things that I know I can't eat, I don't even risk. But the amount of people that comment underneath it being like, I have ileostomy and I can eat them fine. And I'm like, all right, risky business, but you do you.
Yeah, and that's what I'm saying. Everyone's different, but then you have some people that just can't eat the basics. There's one like the white bread or the gluten intolerant. Everyone is different. Like, yeah, I have plenty of patients that are vegetarians, and you're trying to, especially at the start, cut down the amount of green leafy stuff because it sends the output high. But it's just, everything is trial and error. You have to live too. And I always
Yeah.
say 5 times rule test. Once, not even, sometimes 3 times. 3 times, if it doesn't work after the third time, forget about it. But give it a chance. Just because it mightn't work today, it could work the next day. It just depends on how you're feeling. It depends how quick it is after surgery. It takes a while. You start 6 small meals a day is better than 3 large per se with our stone patients just chewing your food well. But then some have their 3 large. Everyone is just different in the way what suits them. And in time, our patients, they learn to know, as I said, their bodies in time. As much as advice, information I can give, everyone's different. And what we want people to do is to try their own thing and see how they get on.
Yeah, just to kind of peel it back to surgery specifically, for the first 24 to kind of 72 hours, if someone's post-stoma surgery, what do those...
Drips, drains, clung to the bed. It depends. Open versus laparoscopic. Laparoscopic, usually they're up and about quite quick, eating light diet. It depends on how big the surgery, if it's open, if they have an epidural, pain relief. Like I always say, it's the one time you get free drugs and here you make use out of it. You need good pain control because you need the pain control to move. You need to be able to get up. You need to be able to get up with physio. I know you have drip stands, but even as I say to the patients, I don't want you walking the full corridor of St. George's. If you just walk in and out to the door and back a few times, it's just getting up. It's just moving your gut, and just movement is the key. And there's dressings, and there might be drain slides, there may not, there may be 2 or 3. Day by day, I say to everyone, these things disappear, and then you're just left with your stoma bag. But it takes a while for things to disappear. Some people have to go home in a vac dressing, which is like a vacuum dressing if they have a big abdomen wound. They might have to have that for 6 weeks. Some might have wick dressings where they're going in and out to the public health nurse. Everyone is different. I have had people that have been up, and if it was just laparoscopic straightforward surgery, up about that evening, going about it. It depends on how well they are coming into it. If you're very, very sick coming into it, it is going to take you a longer time to bounce back. If you are quite well, fit, healthy, not a smoker, lifestyle, all of that comes into it, you would bounce back quicker.
And then when it kind of comes to, I suppose, hospital discharge and the first few days at home, what advice would you offer someone?
It depends where. So we do surgeries from Donegal down to we give everyone enough supplies going home. Sometimes I may or may not write a prescription because I say if they're the Galway patients, I usually see them back in clinic in about 2 weeks. If they are, sometimes I might have to refer out to a company Stoma Care nurse. It depends on where they're living and the geographics. I play everything by ear. They'll all have our contact details to ring us if it needs to change. It depends on where they're from in Galway. They might go out to Anya and Banaslow as a great resource. One wants to face the Galway traffic and coming over the bridge. I'm finding less and less that these days. So I'd kind of give them enough of everything. They have our contact details. They know to kind of go home. They're not going to be bouncing back into it, mowing lawns and running around the place. They just need to kind of take the pressure off themselves and gently get back into moving around and seeing how they're managing. And then they go back and they see the doctors in about 6 weeks usually, but usually they've seen us beforehand. It's different now the way clinics are.
There has been quite a change in the whole system recently. And I suppose, what about the system that you're currently experiencing that was the first thing? If you wave a magic wand tomorrow morning, what would be the first thing you'd change?
Staff. Just the HSC is under more and more restraints, and that's our thing with. We're constantly now getting letters from the doctors about seeing people. While if we were there, it takes the pressure off us, and then it's just easier. And then you've got the pre-op. Like I always say, the hardest part can be A&E, and then when you get through the doors, like we've got an excellent colorectal ward. Everyone is minded well, but it is just the pressures. Like our surgeons are all excellent here. They're They're amazing at what they do. They're very approachable. They look after their patients well. It is good. We do have a good system going here. It just can be frustrating with, it can be better and we want it to be better, but we just don't have the staff to make it better. Like, it's kind of like we're working on a half load thing and trying to do everything that day. And it's like going, you'd get all your notes written up properly. You would get, everything would be on board. It would be great. Like, we don't have secretaries, as you know, to ring and send you out an appointment, or we do all of that ourselves. And that's where it comes back hugely to personal responsibility. And I always say to patients, go, if you have a problem, you pick up the phone, because I don't know you have the problem until you tell me you have the problem, and that is the way
It's very hard to, without the bodies and the all hands on deck, very hard to implement a lot of these things. It puts a lot more pressure on, of course, yourself and Neve.
Yeah.
When it comes to someone who they've had their ostomy, they're kind of possibly not dealing with it too well. Outside of the HSE, is there any kind of support groups they can join up with, or charities they can contact?
There is, so depends on the county. Like Sligo has a support system, Mayo has a support system, Galway did set up one. It depends on a lot of our younger patients just look at it online and they get good resources. And that's what I keep saying. It's like the Crohn's and Colitis. It is our own website. There is different kind of UK companies. It's people you follow. Some people like to follow Mr. Crohn's Colitis. Some people like Sarah Lives. There's loads of different things. It's just getting the right information. I've had people that said about support groups, and sometimes they were like, the Galway one was kind of new, but it's still there, and it's there. But the younger patients are just kind of like, oh, we work, or we're back to busy and lifestyle, and it's time, and everything is about time. While it's very easy to pick up a phone and have a look and have a scroll and see what's out there, but it's just getting the right information out there. And someone was struggling, they'd ring, and if it was even pre-op, I could put them in touch with someone, going, look at you, someone like yourself. I put people in touch with you that are young, that think that you were going through surgery, that just needs tiny bit of support to just contact and just go, look at, I can just get through that. 'Cause support is a big thing. And yes, you have all your family and your friends around you, but also you want to see someone who is going through the same thing or has been through the same thing to talk to. Like, I could harp on as much as I want, but I don't have a stoma, but I just know it from experience from looking after people with stoma. But I could have someone that'd be like, oh, how would you know anyway? It's from experience that I know,
Yeah, it's the importance of the network as well too, that you can find someone who's maybe similar age or similar interest, someone that you can identify with, who they kind of live similar to my life. Maybe I can learn from them. So yeah, I suppose the importance of building a network and reaching out to people who can put you in contact with people. It's kind of a very intense work to be doing. I can imagine there's some really emotionally charged days for yourself. How do you kind of protect your own mental well-being when you're seeing some very, very tough cases and a lot of people who are going through some really tough times?
You try and have to park it your day. When you go home, it's home. You try not to take it home with you. There is nights that I'd be thinking about things, going, should I have done this? Should I have done that? Looking after yourself is the main thing. Like, I love to get on flights. I'm always gone as much as I can. Michael O'Leary and me are best mates, gone for long and stuff like that. I have the gym, also extremely important, great for my mental health. There is days that I take it out in the machines. Long walks. Don't actually, since I've kind of discovered the gym, I don't do the walks as much. But sometimes in the morning, I used to park up early, around 6 o'clock. I'd walk down to the Claddagh, watch the sun come up. It used to be really good as well, just to kind of start the day. Yeah, and it's just like good social scene. You have friends. Sometimes on weekends, I don't see anyone. I'm just worn out from the day, and there's nothing more than a glass of wine and just sitting in front of the fire, or weather like this, just get to chill, and that's the main thing, because you have to look after yourself. Like, if we get sick, there's no one here to replace us. You kind of,
no pressure.
And that's always in the back of my mind. It's like going, when I'd be on my own, and when I was on my own last year after Mary retired, and will be for a while soon. It just takes, I have to look after me, because if there is no me, then there's no one here. And then you've got the severe guilt. It's like, how your patients are doing. There is no stoma nurse here to look after them. Yes, the ward is brilliant to them, but they don't know the products the way we do, chocolate jeans. But it's not their job to know that. They know all the basics, but we're there for support. And I think in our practice as CNSs and as Stoma Care nurses, I think we don't give ourselves the credit that we should give ourselves because of the area of work we do. Like, we are psychologists, counsellors, we're a bit of everything, we need to mind ourselves too. It's just sometimes drawn that line.
Yeah, very hard to do. When obviously to become a stoma nurse, you have to be very empathetic to get into it in the first place. And
Yeah,
you need to help people's mental and physical health, but you
yeah,
can't help their mental and physical health without first minding your own mental and physical health. So,
yeah.
yeah,
Exactly. Yeah, exactly. You do. You just have to. You just have to learn, I suppose, between the two. And but like I said, there is evenings I'd go home and I'd be thinking things, or sometimes I would go on the computer and look up something and I shouldn't, and nearly that's the worst thing, having that. Yeah, it just, or I could wake up and think, no, I should have done that, or I didn't lift. I remember getting caught out one weekend. I forgot to give a patient some and drop back in because I thought they were going home. She weren't going home, so it was just in my head.
that's what you call dedication.
Yeah, I was just like, oh no, God, what have I done? But it just like that thought of it going, oh, they do. And in hindsight, they could have managed a day, like, when I came back. But in my head, I just got so worked up. So yeah, I tried to do that.
That's testament to how much of a vocation your work is, because you understand that you are the best one to provide and have that information and do the thing for the person that maybe someone on the ward, as
Yeah,
much as they're set up for the basics, aren't set up to take it to the next level. But
yeah.
no, Aisling, you've been a wealth of knowledge today. We're hitting to the kind of 45-minute mark. Is there any topics you'd like to dive into that we haven't touched?
I think in one way there's a lot of wastage in Stoma Care as well. I'd love to have little prescription hubs out in the community per se. Just kind of, some people could order too much or order too little, and then we'd get the calls going, what do we do with this? And we can't accept anything back. And it's very hard to find charities to where they go to. Do you know, there is wastage in that regard. Like, everyone should order what they need. Some people do order over order. Yeah, it depends on the companies. They're kind of always told if there's a timeline, if something isn't there, we'd know about it, and there should be something we'd easily accessible rather than patients having to over order. Yeah, things like that. If there was like a little hub in the community, you could review prescriptions. If you had everything that what we have in here out there of all the different companies, and then you can just properly go through, because the GPs and stuff and the pharmacists, when they're ordering, they're not going to know the codes and that. That's all us. If a patient says, I need 10 of that, sometimes it might ring a bell to some of them. They were like, oh, why do you need 10? But say sometimes a box could only have 10 and they would need, depends on how many they use. Some people change things twice a day. Some people are once a day. It's very specific, but there is a lot of waste there. Sometimes I'd like to keep a tab on more. And also I think personal responsibility, that is my main gripe. It's like, patients should know what type of product they're on, what type of bag they're on. It's up to them. You know what car you drive, you should know what bag you're wearing, because that is part of you. That's your life. It's like when patients come into hospital, if they forget their bags, I'm like going, that is part of you. Your family has to bring them in. Someone has to bring them in. I know there's ambulances, but it's like, I could give you a clear bag of something else, and they're like, I don't like that, but I mightn't have the stock of what you're on, because there's hundreds. Or it's like patients would ring me going, Aisling, I need a bag. That's like telling me you need a car. I don't know off the top of my head make and model of everything. Yes, there is some I've seen them recently. Sometimes I'd say if I see them recently, I get brain fog at the minute. But it just depends. I think there has to be a bit more personal responsibility too, coming from the patients, to know what product they're wearing, not to kind of ring and go, this bag, or it's a one piece, or they could think of two pieces just to seal in a bag, like a washer in a bag, not a base plate in a bag, just to know, just the awareness. As I always say to the patients, I don't have a secretary to send you out an appointment. It's like going, oh, I've been suffering. And we don't want to hear anyone suffering. Yeah, people go, oh, you're understaffed and you're under pressures. Yes, but we don't want you suffering at home. We will always squeeze you in. We can rejig things around, We don't want to leave anyone suffering. We don't want to think of anyone at home going, oh, I'm afraid to ring, because it's like, no, just pick up the phone. If I could sort it over the phone, I'll sort it over the phone. If I can't sort it over the phone, if you can't come in, I could find someone to go out. It's all about that. I think patients have to speak up. They have to
Yeah.
be kind to themselves. They have to put themselves first. And as I say to all my patients, everything is a learning curve for the first while. And it takes, You could be 20, 30 years done. Like I've had patients that came to our information night that we had that are done 30 odd years that learn something new. And that's brilliant. And that's why we do them. We do them for the patients. It's not for us. It's like going, one thing I feel like it's the same talks over and over again, but there is only so many talks that we can do, like on nutrition, like on hints and tips. But it's to see all the different companies, and some would find them very confusing. It can be daunting in a room with 13 companies there and different products in different ways. But it just shows them that there is a choice, that you're not fighting this battle alone. There's not one bag that fits all. There's not one size that fits all. Everyone's different. Everyone's tummy is different. Male, female, young, old.
Completely, because even from the talk the last day, Anya spoke about using a toilet roll holder to place in the stoma to when you need to cut the hair around it. And that just sunk into me. I was like, oh, brilliant little trick. Absolutely. But as you said, as much as the information doesn't really change, sometimes you might hear something you've heard before that didn't click. So it's just about the repetition of getting the information into your mind and going to these things, because that's why they're there, is to give you the information. Because just like that, you might not be listening the first day. The second day, something might just go light up in your head. And just on the point of personal responsibility, the best thing I ever did was send myself an email with all my codes on it, because no matter what happens, I could log into my email to find them, or keeping it in my notes, because I used to have it written on a little card. And sure, where's the card? Don't know where the card is. We have the technology, we got to use it.
I know, and they should. Is like, patients think it's funny sometimes now. It's like, but it's a black bag, and I'm like, a lot of companies have black bags now. That's just a new thing. I don't know straight off the bat.
Tons of black bags, like, yeah.
Yeah, they think it's great. It's a black bag, but yeah, more companies have black bags now. It's not as straightforward as it used to be. But yeah, no, but it's great. Look at, I love my job. There is days, I do be cracking up, but it's a very worthwhile job. You get to know your patients so well, and I even find in mine, they'd be laughing at me sometimes. They'd be walking by to the day where I'm like, where are you on holidays now? Or what are you doing now? That sort of way. They know you are, they'd even slag off my husband. They're like, God, we feel so sorry for him. I'm like, oh, it's going,
cheeky
do you
buggers.
have as much at home as you do here? It's like, come out, just telling you, just in a nice roundabout way, open it, and then they just laugh. As I say to some patients post-op as well, there's days that you don't want to see me, and there's days you're not up for anything, and that's fine too. Like, I'm not going to send you home without being able to do it and manage it. You'll be sick of the sight of me by the time you get home. There is days you're not up for it. You have to be kind for yourself. You have to know your body. You have to just take the time,
Yeah. And it is just repetition. I know I interviewed a guy a couple of months ago, and he said it's like you're a 5-year-old who's getting used to, if you have a stoma for 5 years, you still have that new body only 5 years. You're a 5-year-old, really, like you're a toddler. You're getting used to a whole new system and a whole new life. And it really sunk home for me, because for the first couple of months afterwards, you're kind of you're figuring out how everything works and how quickly you can change it, and stoma output. It's only like, and even now for 14 years, things can crop up where you're thinking, I didn't think there was going to be output there for another hour, and it comes quite quickly. So, it is the nature of it being ever changing, and things can crop up on a day that you might not expect. So it's great to let people to know that the first few months are quite hard, but things do get a lot easier over time.
And like which actually is another thing actually came into mind, knowing which stoma you have. People would just go, I have a stoma, and I'm like, yeah, colostomy now or an ileostomy, because they're two very different. It's the same way as washing, drying the skin and putting a bag on, and you're probably wearing, some patients wear the same bag on both. But it's to know which one you have too, as a just in case. For something even like bowel prep, if you're going in for a scope, ileostomy should never have bowel prep. There is no need. It's just also a learning curve to kind of take note of what you have.
Yeah, it all comes back to the personal responsibility of kind of knowing your body, knowing what you need, so that people can help you the best they can when they have the correct information. It's absolute facts. It's been absolutely fantastic to get you on and share the information that you have, because it is a complete vocation you do. And the stoma nurses, everyone in our community always say the stoma nurses are our guardian angels, because they're there to provide us with the information and look after us when we need them. So on behalf of all of the community, we appreciate the work you do so much.
Thank you. No. It's great. That's what I said. That's why I like my job so well. There is a lot of job satisfaction in it.
You're really giving people a crutch, and not even a crutch until they don't need it anymore, to provide them with the information till they can go off. And as you said, it's quality of life. It's not surgery, it's quality of life.
And to know they always come back. You could ring me 20 years' time. You could move to Australia. Could get a phone call from Australia someday going, "Hi, Jonathan here." I'm like, "Can I text it now?" I might be the other end of the phone line at that. I do go home.
Yeah. I'll ring you in 6 months' time. Like, I'm still in Australia, just checking in.
Yeah, just check.
No, it's been fantastic, Aisling. I appreciate you taking the time today.
Not at all. Thank you.
That was episode 8. If you enjoyed the episode, please take a second to subscribe, leave a rating, drop a review, and share this episode with someone who might need to hear it. Every share helps us reach more people with IBD, ostomies, or living with chronic illness. So thanks so much for listening. We'll see you in the next episode.